Welcome back to Houston Life. You know, next week, a well-known Houston cancer doctor is getting a major honor at the Texas Medical Center. Dr. Philip A. Salem will have a conference center named for him, and Dr. Salem is the founder of Salem Oncology. He has spent more than 5 decades working in cancer research and patient care, and his work has helped push new approaches in how cancer is treated. And today, he is joining us. Dr. Salem, thank you so much for being here in the Houston Life studio.
Thank you.
I know I've been to your clinic.
It's a great pleasure for me to be with you.
Oh my goodness. I mean, the honor is all ours. I've been to your clinic. I've met people who you help. I mean, the work that you do is absolutely amazing. 59 years you've been doing it.
59 years.
For a long, long time. What keeps you going at this point in your career?
My hobby, I have many hobbies, but the hobby that I love the most is my job. My job is to salvage human life. I cannot think of a more noble and grandiose objective. I love what I do, and I thank the Lord every morning for giving me this opportunity to treat the sick, indeed the very sick, the cancer patient.
Oh my goodness, and of course so many people's lives, they owe their lives to the
Sure.
work that you do. What do they say? Do what you love and you never work a day in your life.
Absolutely, absolutely.
It's absolutely amazing. Now, what you do and what I've spoken with you about is this idea of treating the whole person.
Sure.
What does this mean exactly?
One of the challenges in American medicine is that the doctor should see the human behind the disease. We are not treating disease per se alone. We are treating a human who has the disease. The difference is huge. In my office, it takes me 1 hour per day to treat the disease, but it takes me 8 hours a day to treat the human behind the disease. It is very important before you start treatment and during treatment that the doctor takes time, sit with the patient, alleviate his anxiety, answer all his questions. If you also don't embrace the patient with education, with love, with compassion, the patient may decide to stop treatment because of toxicity sometimes. The best way to make the patient continue treatment is to embrace him with love and give him hope, real hope.
Wow. It's absolutely amazing that it is more than just one thing, and it is that holistic approach that you have.
Sure.
But part of that holistic approach is something that you've pioneered, IC triplex. This is part of that very special treatment that you give people who are fighting cancer.
Sure.
Let's talk about this for people who wouldn't know what that means exactly. How does IC triplex work?
We, like 8-9 years ago, we started a program where we give patients the combination of 3 approaches: immunotherapy plus chemotherapy plus target treatment. The reason is because if you look at the cancer cells in an individual patient, these cells are not the same. Some respond to immunotherapy, some respond to chemotherapy, some respond to targeted therapy. The traditional approach is the sequential approach, that you start with 1, it fails, you go to 2, it fails, you go to 3. We think a better approach is to give the 3 together from the beginning. That's a major difference from other attitudes in cancer research. The second, and which is probably the most important, is that we have learned over the last 10 years that there are no 2 patients who have exactly the same disease. You know, the disease is indeed like your thumb. When you sign, you stamp it. Nobody else in the world has that marking, and it is the same in cancer. Every patient has a disease which is slightly different from the other, and therefore the traditional approach of treating hundreds of patients with the same protocol is not a logical one, is not an ideal way to do things. I think we should move from this traditional approach to a new approach where every patient receives a treatment designed to him and designed to the specific cancer that he has. That is the power of IC triplex.
That is absolutely amazing that you've been part of bringing that to people and helping them in their cancer fight.
Sure. You know,
amazing.
How we started, we had patients, 2 patients from major cancer centers in America who were told that there is no more treatment for them. They exhausted all traditional therapy. And we tried IC triplex, and we got amazing responses. One of them is still alive 5 years later.
Wow.
After he was told by a high-ranking cancer center that he has 3 weeks to live. So there is always hope. You know, we are advising, our advice to the medical oncologist is that when he feels that he is against a wall, that the patient has exhausted all traditional therapy, we are giving him a new option to try. Perseverance is a key issue in the treatment of cancer. It is not only needed on the patient side, but also, more importantly, on the doctor's side.
It's absolutely amazing the way that you treat cancer, the way that you're helping people right here in Texas, throughout the world. And of course, you are being bestowed a great honor and a well-deserved honor. Next Thursday,
thank you,
there will be a conference center in the Texas Medical Center at the Dan L. Duncan Comprehensive Cancer Center. It will be named in your honor. We are going to be there. Houston Life will be there because it is going to be a very special day. But I mean, this is absolutely amazing. We have sitting here between us, this is a proclamation from the governor from the state of Texas honoring the work that you do. It is absolutely amazing. Dr. Salem, how do you feel about it?
I feel great. I feel great.
An honor so well deserved. Many of your patients, your colleagues would all agree with that. Thank you so, so much. If you want more information on Salem Oncology, you can jump online, salemoncology.com. You can also give them a call. The number is 713-796-1221. Houston Life will be right back.